Hello. As part of your medical care, you often need an X-ray or scan to see the inside of your body. This helps your healthcare team detect a range of conditions. These scans are quick and painless, but they do use radiation, which can have side effects. This video will explain the risks associated with radiation. Radiation is the energy or particles emitted from any substance which is naturally radioactive or has been changed in some way. We are all exposed to background radiation every day. This comes from the ground and buildings around us, the air we breathe, and even from outer space. Each medical X-ray or scan gives us a small extra dose of radiation on top of this background radiation. There are various types of imaging that use radiation. The first is radiography, or the basic X-ray, which we're all familiar with. X-rays are commonly used to look for broken bones and lung problems. These usually involve extremely low amounts of radiation and are equivalent to just a few days of natural background radiation. Fluoroscopy is another imaging method. Here, X-rays are used to produce a moving picture. It is often used to look at the gut or a moving joint. It uses higher dose of radiation and is equivalent to between a few months to a year's worth of natural background radiation. Another imaging method is computed tomography, or a CT scan. During a CT scan, lots of cross-sectional pictures are taken of your body. This can expose you to as much radiation as fluoroscopy, and sometimes more if large parts of your body are being examined. This means that a CT scan can be equivalent to a few years of natural background radiation. Before we think about the effects of radiation, it is important to know that in general, 1 out of every 3 people will develop cancer at some point in their life. Unfortunately, being exposed to radiation through X-rays and scans can increase your risk of developing cancer over your whole lifetime. However, the increased risk is generally very small. The potential side effects of X-ray examinations take many years to develop, but this risk needs to be balanced against the medical benefit of being diagnosed accurately and receiving the correct treatment. If you have one chest X-ray, your risk of cancer is increased by 1 in a million. This means that for every 1 million people who have a chest X-ray, 1 person will develop cancer. But in general, the benefit of diagnosing a medical condition such as pneumonia or a broken bone far outweighs the tiny risk from radiation. As CT scans and fluoroscopy use higher doses of radiation, the risk of cancer is higher. For example, a CT scan of your tummy can increase your risk of cancer by up to 1 in 1,000. This means that for every 1,000 people who have a CT scan of their tummy, 1 will develop cancer. However, the benefit of having a medical condition diagnosed and treated outweighs this small increase in the risk of you developing cancer. It is important to remember that it is the job of the doctor and the radiographer to balance the risks and the benefits of the examination. As the potential side effects of radiation do not develop until many years later, children are at a higher risk from radiation than adults, as they have their whole life ahead of them. Particular attention is paid to ensuring that there is a clear benefit for every child who is X-rayed or scanned. If you are a woman of childbearing age, you will be asked if there is any chance you could be pregnant. This is because a baby in the womb can be more sensitive to radiation than an adult. However, X-rays of the hand or the chest do not pose any higher risk because the radiation does not go near the baby. In radiology departments, every effort is made to keep radiation doses low. But if you are concerned about the possible risks from an investigation, you should ask your doctor, nurse, or the radiographer whether the examination is really necessary.